Whether you're a parent navigating myofunctional disorders or simply curious about optimizing your family's overall health, the MyoHacker Podcast is your guide. Hi, I'm Karindy, a speech-language pathologist, myofunctional therapist, and a mom on a mission to bring holistic health to you and your family. Together, we'll explore whole-body connections and integrative solutions. Please subscribe and leave us a 5-star review to help other families discover this important information. Visit myohackerslp.com for free resources and guides. Quick disclaimer: the content shared in this podcast is for information and entertainment purposes only. The views and opinions expressed by the host and guests do not necessarily reflect those of the podcast or its affiliates. This podcast does not provide medical, legal, or professional advice. Always consult a professional regarding your circumstances. By listening, you agree that the host and podcast are not responsible for any actions you may take based on the information provided. Now, let's dive into today's episode. With us today is Dr. Julia Sadove-Lopez. She is an incredible airway dentist who is helping families across the globe with figuring out what types of treatment options are best for them, for different age ranges, and really helping get clarity in a space that can be very overwhelming and confusing. So, Dr. Julia, thank you for joining us today and welcome.
Thank you. This is one of my favorite podcasts, so I'm excited to be here.
Yes. So I want us to dive right in to your incredible support that is in the Smile Support Stair Steps handout. Do you call it an ebook, PDF?
Yeah, ebook. Ebook is what I've been rolling with, yes.
Love it. Okay, so let's dive into this. So for parents that are like, all right, I'm looking at the tooth pillow, but I've also heard about a rapid palatal expander or a fixed expander, but then I'm looking at things that say maybe just exercises. They're very overwhelmed and not sure where to start. This handout is so well organized and really gives clarity. And like we were talking before recording, you don't have a horse in this race. Like, you are not making money off of people choosing one type of treatment option versus another. And so you really are just going, these are the differences. These are the different types of appliances, and you're clarifying it. So let's talk about here you have your Smile Support Stair Steps. Bring us through that, and then we'll talk about the appliances themselves.
Yeah, so the concept behind the ebook is just I finally decided I needed a better system to make sense of the different sort of dental treatments that exist. I do always like to kind of put that in the container that, of course, dental treatments aren't the only way forward, and there's a wide variety of professions and different treatments that should be involved. But when it really comes to things that are being done in and around the mouth, I felt like we needed just a little more clarity on what those options were.
Absolutely.
So then I created the system, and essentially what I've done is I've made 3 categories. And I call things the natural nurturers, the guided growers, and the foundation fixers. And so with this, the concepts that I've laid out is that as we move through these different categories, the thing that really shifts over time is that as we go from kind of more natural ways of supporting the body to some ways that apply more external force, that is kind of the gradient that we're working on is more gentle, self-created forces or externally applied forces. But as we move through that, we also see that we're seeing more precision. So a lot of times what happens and what we can support naturally is really wonderful, but we don't always know that we're going to get a specific, precise outcome versus when we're sort of planning these things from a more, I guess I could say, with surgical precision. When we're planning these things in a different way, we sort of know the exact endpoint that we're aiming for to consider that something's complete. So that's kind of the overarching theme behind how I've made this guide and laid it out.
So someone's listening, they're like, natural nurturer, what is that? Can you give some categories of tools, appliances that fall into the natural nurture bucket?
Yeah, absolutely. So for me, these are going to be more along the lines of I do actually include therapy and myofunctional therapy in that natural nurture bucket. I do also think of some of the more habit correctors, things like tooth pillow, healthy start, some of those Myobrace, those types of appliances, as well as when we look at the light fire appliances. So things like the ALF or the Crozat, those kind of to me are some of the examples of what falls into a natural nurturer because by and large, we are using the wisdom of the body. We are retraining or promoting the natural body wisdom to do its own thing. It's kind of in line with osteopathic principles in many ways.
Yes. Yes. So then, okay, someone's listening and they're like, that sounds great, but I'm in a little bit more of a hurry.
Hmm.
Got to do something now. Tell
Yeah.
us about the guided growers.
Yeah. And so the guided growers are kind of an in between. And I love that you just made that distinction because my whole point in dividing these different groups up, it's not to say that like this is what you should be doing, this is what you shouldn't be doing. But yes, if we have a greater sense of urgency and somebody's dealing with different symptoms, then there are going to be different times where different appliances might be more appropriate than others.
And that, I want to highlight, that is going to be the benefit of when someone wants to actually be working with you directly in like your coaching capacity to differentiate which bucket is actually a better fit for their
Mm-hmm.
given situation and context. And this is, obviously, this is when we want you working with a team and when we want you working with someone that can give you specific guidance. So if you're like, wait, how do I know? That's how you know.
Yes, perfect. And so yeah, those kind of middle ground of guided growers, I think of those as anything ranging from without kind of overwhelming the situation. I know I already mentioned like Healthy Start and Tooth Pillow and those things. Those kind of have different stages built into their programs too. So the first stage of those falls into the natural nurturers for me. And then sort of the second stage of those falls into this guided grower category where we're now going to be putting a little bit more. The second stage is like you actually have to do like biting activities into some of the appliances. So we're going to be activating different muscle systems in different ways. And that kind of carries over into what would be another category of the guided growers, which would be functional orthodontic appliances as well. And the whole concept behind a functional appliance, it's something that I really had a very limited understanding of while I was still living in the US versus what I've come to understand a little better
Guys, if
from
you didn't know, she's super cool and she lives in Portugal and does like all the cool things. So go follow her on Instagram at oris.wellness if you just want to see like beautiful pictures of traveling through Spain and things like that. So that aside.
Yes, yeah. So in Europe, I do think that there are some different concepts, and functional kind of orthopedics is a concept that's a little more accepted here. And that's where
Yeah.
we're really retraining the muscles of the jaw, the muscles in and around the jaws to position differently with the idea that over time, that new position becomes our baseline because our growth will modify in response to the signals that we're sending from that new positioning. I also include things like Invisalign or clear aligners into the guided growers, some of the, again, different systems there and some of the cool systems like Nuvola is a little bit of a modification, which I believe you guys have had some conversations about in the past. Removable expanders for me, that's still going to be a guided grower because it's removable. So it gives kind of built-in breaks in the forces that are being applied versus as we get into the other category that we'll hit next, things are more permanent kind of sustained forces.
So if someone's like, okay, natural nurturers, those are going to be things that are helping with like habit correction and osteopathically really supporting the cranial growth, changing how the swallow is impacting the sutures. And this is, changing craniosacral rhythms, all of these things. Like that's a whole body impact just through the swallow, through where the tongue is resting, through how you're breathing. Of course, all of these, you're going to have better outcomes if you're nasal breathing. So, and then we move into the guided growers. That's going to be those eruption guidance and bioactivators. Can I just say it's a great little title right there? And then you have, like okay, Vivos Grow. Wait, like you break down, there are some things that fall into different categories, and they can be in multiple categories, which I think that's where things get confusing, because people are like, wait, I was recommended that I try this tool as a habit corrector, but this person's saying it's going to grow the width of the palate. I'm confused. And you give clarification through this system of some of those things. And then we've got, so the functional and orthopedic appliances, and then there are multiple things in there, so I won't even try and like name. I'm not trying to name everything in all these buckets,
Yeah.
guys. That's here's a shout out to just get it. It's not like a super pricey tool to just get this PDF. But then you've got those aligners and hybrid systems, which I feel like so many things are kind of hybrid systems because you're having to change practically how you're functioning. But there are multiple like levels and levers in a way that you're activating through these hybrid systems. And then we have the
Mhm.
removable expanders. So if you're listening, you're like, wait, expanders, there's just one kind. They're just fixed appliances. No, there are different kinds. So yeah, I am really happy with what I'm seeing with the Invisalign palatal expander. It is a removable one, but for the most part, as you're going through it, you're wanting to keep it in.
Mhm.
But that's why it's almost a hybrid, like because then we're shifting, we're increasing. Okay, we won't go too specific there, but guys, if you're like, oh, I want to hear more, reach out to Dr. Julia. All right, then we have the foundation fixers. Tell us about
Yes.
those.
Yes. So I do kind of make a little caveat as we enter into the foundation fixers regarding the force application with braces, because
Mm-hmm.
I commonly see people sort of making braces the villain in this narrative. And an overarching message that I want to make sure anyone thinks about as they consider all of these options, they are all just tools. The
Right.
braces are not the villain. So when someone says, I'm hoping we can avoid braces, that's not necessarily my end goal. Even if you're trying to think about things in the most holistic way possible,
Right.
braces are just one additional tool. So, my caveat going into this is that braces actually are going to apply less force than a lot of the removable expanders if you think about it
Mm-hmm.
like that. So, that's kind of my little point of attention on that, is that even as I've tried to break down the system as clearly as possible, I do like people to understand that there's actually less force often applied through braces than there are through removable expanders.
Even that, I
So,
want to say, like, with braces, I think so much about it is how were they trained? What is the mindset? I think of like
absolutely.
the braces I had when I was in high school and how they literally just left my back teeth kind of hanging out, not at all a part of the plan. And so they just squished everything together, pulled it anteriorly. And then, of course, I had buildup and problems with food getting stuck because they literally were like, bye, teeth. This is all about how things look, need to be straight. And so that's the problem. I think that's why they have become villainized, is because it's been viewed as like, well, they just are addressing how my teeth look and not how I function. And the really what we're seeing in a wonderful way is more and more providers are seeing, okay, no, I want to address root cause issues and I can use braces in a way that is supportive. And they're getting that training. I mean, some of them are doing, cranial training and specific things to see how this can impact the bodily function.
Yeah. No, I think it is worth the sort of shout out and attention to that, because at the end of the day, I think having conversations with providers about the tools that they're using
Mhm.
is one way in, but
Yep.
certainly understanding their philosophy, how they're working like collaboratively with other providers. Do they promote expansion versus retraction? Do they even acknowledge that airway is part of the story? Because a lot of providers are still in sort of this kind of awkward denial phase of like, oh, we do orthodontics, but we don't, that airway thing, it's not real, or it's not like, regardless of where we land, at the end of the day, there's our body function matters too. Without a
Yes.
doubt, I think
Yep.
we have to agree function matters too. So, yes, anyway, I think that was an important distinction that you brought up. And yeah, as we move through the foundation fixtures, moving beyond braces, we might have the fixed expanders. We might have extraoral face masks where, again, instead of the kind of reason why we have the bad raps from the past is we had often braces with the retractive face masks, and we certainly don't want that approach anymore. But protractive face masks can
Can
be
you
really helpful.
explain for someone listening? They're like, what is she talking about? What is
Hmm.
a face mask? What is
Yeah.
retractive versus protractive?
Yeah.
Actually, I think my ortho just said we're going to put this thing that looks like a giant bow on my kid. What is she talking about? Can you explain that?
Yeah. So I do like there's a little YouTube video you can find somewhere called the story of headgear is what I believe it's called. And
Okay.
so that's kind of worth just a little kind of summary glance at it. But the headgear we had when I was growing up was like you would go to sleepovers and people had to put on their headgear, and it's this mask that kind of had straps that went up kind of across the forehead and from the chin, and kind of pulling things up, because a lot of times what happened was if someone had what we would call like an overbite,
Mm-hmm.
the thought process at the time was that the upper teeth were growing too fast or too far, and things needed to be pulled back to match the lower jaw. And that's a big part of this kind of controversy within orthodontics at this point is we've really come to understand that in many cases it wasn't that the upper jaw was growing too far forward, it was that the lower jaw wasn't having a chance to
Yeah.
grow forward enough. And so that was kind of the old concept of headgear. Now, when we have something called like a face mask or a protective face mask, it's kind of doing the opposite. In many cases, you'll have the opposite. You'll have someone with like an underbite position to where their upper jaw maybe isn't growing forward enough, and relative to the lower jaw, we now need something to kind of help us externally pull the upper jaw forward a little bit. And so that's where these face bows and face masks that put pressure on the forehead and the chest and kind of pull things outward, they're providing just an external force application to help drive some of that growth so that it's not all coming from inside the mouth. Whereas, with some of our more dental options, that is where the forces are happening, is by promoting better tongue support and,
Mm-hmm.
and expansion from within. But this is sort of offering external momentum in that way.
Yes. Okay, real quick. My brother, he had headgear. So I lived in Bangladesh when I was in high school. My brother did too with me. And he had braces and headgear. And there wasn't even an orthodontist in the country when we lived there. And we'd be walking around and people literally thought he had like a fever and that it was to keep his teeth in. So it was amazing. Just saying, a cultural experience that headgear hasn't been, a factor for every country. And it can look kind of weird. But
That could
I
be a
do.
whole like Weston Price conversation spin off there too.
No,
But
literally everyone there ate sugarcane, chewed on
interesting.
sugarcane all the time. And I remember thinking, like, why don't they? Oh, they're going to get cavities. Not realizing, like, no, they have these wide, beautiful jaws because they're chewing on sugarcane all day long. Like, meh. Okay. I do want to say, with some of these external forces that sometimes I'll see, like, I used to be like, okay, you're going through expansion. I'll see you in a little bit. Go through that. I now really like to see patients as they're going through that process, especially if they have some of these external forces, because it can be like, whoa, the body was giving on one side and not the other. And we have bowed forward with specifically one side a lot more than the other. And there are things we can correct very quickly functionally when we're seeing that. That's obviously going to be like a whole body strain issue. And are we seeing a significant reduction in cranial movement? I will say a lot of these, if you're listening and you're like, I do craniosacral fascia therapy, Karindy, what are you doing? Stand up for whole body movement, cranial movement. I hear you. But I want to say that there are reasons we want to open up the airway, give the body that support, and you can support the cranium. You can support the fascial movement throughout the body as people are going through these processes. And I used to not hold to that. I used to be like, no, only one. But that just doesn't work. Okay. People are in different locations. They have different resources, they're not necessarily going to fly to a new state to find a provider who does a specific tool for them. And I actually think it's really beautiful if we can see all of these different appliances for the most part in a context of how do we support the body to integrate these changes so that rather than it increasing strain patterns, it's helping them move through them so they are fluidly breathing, sleeping, moving in a healthier way. Okay,
Yes,
I'll get off that.
I know, I absolutely love that, and I think it's so well put because that is part of what I would recommend for any family that, for best supportive practices, if we have to turn to these more fixed or more sort of aggressive forces in some ways, what can we
Mhm.
do to make sure that we're really kind of still supporting the whole body? So I completely back everything that you said. And yeah, that kind of rolls into too, like kind of the end of the foundation fixers is looking at sort of surgical interventions. And sometimes we do need surgeries. And of course, it's typically not anyone's first choice to dive right into surgeries, whether that be some of the more invasive things that we see in the dental field happening with MARPs and SARPs and things of that nature, but also
Can you describe
frenectomy.
those real quick if anyone's
Yeah.
listening?
Yeah. So rather than being like a tooth-borne expander where the forces are kind of anchoring off of the teeth and expanding the palate, these are going to be guided. Well, MARPI is going to be guided by some implants that go into the roof of the mouth. And then that's going to be what's sort of pushing, allowing the suture in the middle to be cranked open.
Uh-huh.
And SARPI is going to be where there's like a surgical incision to kind of like pre-open that so that you're not just pushing bone until it splits and opens on its own. That's in preparation for the expansion, they can do a little incision and prepare for the body to open it a little. In it depends on how you look at it. Is one
Yep.
more gentle than the other, right? I mean, they're both different ways of opening up that midline suture of the upper jawbone.
Yes.
But yeah, then there's also, I mean, frenectomies are a type of surgery when we think about that too. So there's definitely different things that, again, like, have we tried everything? Have we looked at all the variables before deciding that a surgery is needed at this point? But
Mhm.
at a certain point, for a lot of families, surgical intervention is a part of the equation and a part of the story that can be really life changing. So
So let's say someone's listening and they're like, okay, I'm just getting started. Like, what are some things that you recommend? Let's say this is a family, a mom, and she's like, I know we need to get started. What are some things that I should consider when I'm reaching out to providers? Like, what are maybe red flags that this isn't going to be a good fit, and a green light that you're like, no, this is the kind of interaction you want to have with a provider who has, whether it's a growth guidance appliance or if these foundation fixers, like what are some tips that you can give that mom so she doesn't feel like she's totally out on her own trying to navigate this landscape?
yeah, and so that's part of what's built into my ebook guide as well is some pointers and things to look at when it comes to just kind of interviewing different providers. Because as we talked about, the tools can be there as a conversation piece to sort of get a feel for what a provider's philosophy is. But at the end of the day, like, we're there to figure out what the provider's philosophy is.
Hmm.
And one of my personal favorite recommendations is asking them what got them into this more like airway or functional space in the first place. Because I
Hmm.
think the vast majority of people in this space have gone in for personal reasons. And I think it really humanizes the care that they're going to receive when we can understand the personal journey that someone's already been on. So that's one of my top recommendations. If people aren't having that conversation, I think it's absolutely worth it. How do you collaborate with other professionals? If they use multiple tools, I always think kind of understanding why is one course of action being recommended for my specific child. If you arrive to the point of understanding what their treatment recommendation is for you, I know in many cases, and in some cases, again, due to what you said, if there's geographic limitations or there's other variables that are going to limit the options available, maybe we only have a few things available. But if a provider is making a recommendation, I think it's important that we understand why this tool is being recommended for your child.
Hmm. Love that. So, okay, now someone's listening. They're like, well, how do I find these providers? How do they find them? I'll just say I'm teeing it up because you actually have a great resource for providers to refer to. But I mean, really, that's going to be the benefit of people working with you, connecting with you, is you do have now this referral network and you know people that are going to be different connections. Like I just think of a beautiful family that you've connected me with, and you just knew like what they were wanting and they wanted more of a holistic approach. You know, I'm in Houston. We have fantastic myofunctional therapists here, multiple and different approaches, different viewpoints, and all talented. But you knew like it's not just about the geographical location. Like, go see these. You knew like what was going to be the better personality and even just like what these people were wanting as far as their outcome. And so I just think that's a really cool point that you offer for families trying to find a good resource.
Thank you. That means a lot. Yeah, I do try to take that into consideration as really understanding again each child as an individual, but each family as this little microsystem and trying to understand what is going to be the best fit for them. And so sometimes through having a deeper conversation and understanding, what types of medical treatments that they're open to or into, just understanding more about that family's philosophy and the family's motivations, because what their primary symptom is might change kind of where they go first, like the symptom of concern. Also, you know, like you said, it's not always like this is the best provider in an area, so this is who you have to go see. And I think that's one of the things that's really shifted in my own mindset as I've gone from being a chairside dentist to being more of a coaching role is really seeing like it's not my job to tell people who the best person is. It's to kind of match and help support them and guide them on the best journey for what's a good fit and alignment for them. But yeah, for me, I do have now a mega directory that I've created for other professionals to use to kind of guide finding these providers, because over time I just was having to pull from a lot of these resources myself as a starting
Uh-huh.
point in any given geographic area, knowing that maybe I have a hunch that we're going to start with myofunctional therapy, or maybe I have a hunch that we need perhaps some hands-on manual therapy or something first. Like, where are we going to go? What are we going to do? So I certainly, providers like us, we're doing our best to match families with the providers who are going to be a good fit for them. But I also, yeah, there's a lot of different directories. If you contact me and you want access to the directory, I did make it with the intent for professionals to use, only because I've gotten the feedback so far that it might be a little overwhelming for parents. But I
Absolutely.
say that with a caveat, because the reality is so many of the parents that reach out to us in a certain stage of knowing that they need help, they've done so much research and pieced so much of this together
I know.
that they often do know more than potentially some of our peers that haven't gone down this sort of airway or functional rabbit hole yet. So if you're truly wanting access to the mega directory and you're a parent, I'm not going to stop you, but I think it could be overwhelming if you don't know enough of what you're looking for yet.
And props to you, that parent that's listening and has done so much research. Like, my patients are so well researched. They have done so much work. And sometimes as providers, like, we're deep in treatment. We're not necessarily out there seeing all the newest and best things. We try, but sometimes I'll be like, wait, what? Tell me more, share. So I do want you guys to know, like, you are doing a lot of research and it really does count. That resource you were mentioning is a part of the kit. So briefly share with providers what the kit is, why they would want to join it.
Yeah.
There are aspects to it that are going to be almost community making and building.
Mhm.
So share about the kit.
So it's called the Collaborative Care Kit, and it came about from having just some open conversations with other providers. We had all different sort of professions on the calls just to discuss what are some of the challenges that we face in trying to work in this interdisciplinary space where we're working with the lactation consultants and the myofunctional therapists and the occupational therapists and the dentist, and we're trying to coordinate everything, but like, what are the challenges that we face? And so from those conversations, I was listening and I took that feedback and I made some resources, and it's now available as a kit. And thank you for supporting the kit. So yeah, that was my goal, was to make a bunch of tools available that are going to make people's lives easier, because at the end of the day, this is how my brain works, is I like to create these structures and make sense of things and create resources for the busy clinicians that don't have time to kind of sit down and analyze things and break them down, because you're still busy deep in doing the very important work that you're doing. Let me make some of the other parts easier for you. And yes, there's going to be some optional live calls for anyone who has gone ahead and purchased the kit. And that is to continue this dialogue, to figure out what else do we need in the space? How are these tools helping? Are people seeing success with these tools? Can they share those stories with others in the community so that we can kind of learn from each other? And that was part of kind of even making the mega directory in the first place. Was on one of those live calls, we had a few people on the calls, and some of the people participating in the calls have their own directories or are a part of a foundation that has their own directories. And we had other people on the call who were doing amazing work who had no idea that those other resources existed. And so if I can do my part in kind of making my job to be aware, like you said, of what's going on in this industry and what's going on in this space, and make meaningful connections for people so that now everyone can know about that directory and everyone can have access to that and be able to benefit from knowing about that, then I think that's a win for all of us that are trying to improve this space together.
Absolutely. And I think right now, if you're listening, you're like, well, I can just go chat GPT this. Guys, no, it's not curated. And it also, sometimes it's just flat out wrong. But I mean, so there are wonderful benefits to AI. There are, that's this whole other discussion, but there is a benefit to, like, this is someone who's interacted with these providers and engaged with them, has seen outcomes for families. And it's not just like, oh, it's pulled a Google search result. So so much, I wish it was more simple, but no, like, you do want people that have interacted with providers. And with all of these, as we're talking about it, even that, like, there are going to be different personality fits, there are different experience and skill levels. And, sometimes it can be overkill for one. And sometimes it's like we need different fits based on where people are at, what they have going on. So I want to encourage you, if you're like, well, I'll just figure this out on the internet. Okay, but if that doesn't work out, go ahead and reach out and get these resources, or reach out to Dr. Julia, and she's really great at responding on Instagram in her DMs. So before we go to our next question, actually, how can people connect with you? All the places: Instagram, your website.
Yeah. So my website is my company's name, oriswellness.com, and my Instagram is oris.wellness. And if you go through my website, you'll find my email contact, or there's a contact page there that you can also send a message if you're not on social media. That's no obligation. But yeah, I'm just always happy to connect with parents or professionals that are trying to navigate this space and help serve as a resource in any way that I can.
I love that. And guys, by the way, if you're like, oris, what is that? It's for bicularis oris, okay? Like the lip muscles. Thank you so much for listening to the podcast. Please subscribe. It really helps to get the podcast out to more people when people subscribe. So if you could subscribe, rate, and review the podcast, it would help it. Right now, I'm like right in between a bunch of like sleeping podcasts. So I guess I'm right there with white noise. So if you guys would rate and review the podcast, that would be fantastic. It'll get it out to people who don't want to just sleep while they listen to it. And I really want to get this information out. So if someone is like, I don't know what kind of appliance I should get, this is the episode to share with them. So please, that person. It might be you, but I want you to share with individuals who need to hear this information and get that clarity. So thank you so much for listening to the podcast. Go check out Dr. Julia at oris.wellness on Instagram. And check out her resources. They're wonderful. Thank you so much for listening to the podcast and have a great day. I hope you have enjoyed this episode of the MyoHacker Podcast. Remember, small changes can make big impacts on our overall health and well-being. If you enjoyed this episode, please take a moment to rate and review wherever you get your podcasts. This way, more families will learn about this important information and we can make a bigger impact. Head on over to myohackerslp.com for in-depth resources and guides. You can also join me on Instagram at myohackerslp for bonus content and demos. And if you have questions or topic suggestions for future episodes, send me a message. I would love to hear from you. Until next time, let's biohack myofunctional health as myohackers who change the world through intentional action and connection and breathing. Quick disclaimer reminder, the content shared in this podcast is for informational and entertainment purposes only.